Alright, hi guys, a very good evening to all of you. Welcome to this last minute revision part 2 today, and in the previous session I have already discussed part 1 and I hope all of you guys have already enjoyed part 1 series. And as I said previously also that this part last minute revision will be equally important for the FMGE students and also for the NEET PG students, right, and other PGME examination. And definitely we will try to carry forward this last minute revision series, and the aim is to cover as much as 100 question in this one. Okay, so before I start this session, please let me know if I'm clearly audible and visible to all of you. All the students, those who are live right now, please let me know if I'm clearly audible and visible. I'm using another system here just to reply to your messages and check back on the replies that will be coming. So what the aim of this type of series will be discussing all the high yield topics, right? Like last time I have discussed few of the important high yield topic from cancer, some high yield topic from your general pharmacology as well, then some from the autocoids as well. Likewise we'll be discussing in this particular series as well. Please let me know if I'm clearly audible. Dr. Sandeep and other students, please, all the students those who are live right now. Part 1 has already been conducted, so it's a humble request that whenever you get time, please go through the part 1 as well, because all the topics that we are discussing are high yield topic, and this high yield topic, why we are telling, on the basis of what has been asked in the previous 10-year examination. So upon studying those, studying those questions, the topics are being discussed in this particular series. Okay. This is a quick introduction about your subscription that you needed to if you are coming on the plus courses, you can buy, right, for 1 month, 3 months, 6 months, 12 months, or depending on your need, right. Apart from that, you also have the option to buy Unacademy and Transplant together. Okay, that is another option that is also available, and you can use the code as it's already has been given, and I have told you previously as well that the code that you can use is your Siraj Ahmad 9. So you can put the code here, that's my name itself, to avail a decent 10% off in your overall, right, fees. Okay, so I hope everything is fine, and now we can start the discussion already. Rest of the students, they will be joining, and the topic that we are having, as I told you, on the basis of the previous examination. Okay, let's get started. The very first question: preferred drug for early phase of West African sleeping sickness. Multiple information has been given here, right? West African sleeping sickness and early phase of West African sleeping sickness. Which of the following is the preferred one? All the students, those who are live right now, please provide your answer in the comment section. In the comment section, please provide the answer, guys. Okay, Dr. Shantan Basu started already. That is C, benzimidazole. Very good. Other students, please. जल्दी बताइए, because questions ज़्यादा हैं and we have a lot to discuss, because what is important here is not the question per se. I'm never claiming that this question is going to be very, very important for you, but what we are going to discuss, the topic per se, will be, right, relatively relatively more important, I can say. Okay, now whenever we talk about African sleeping sickness, very good. So let's start quickly. Whenever we talk about the African sleeping sickness, okay, African sleeping sickness. Okay, this African sleeping sickness is further divided into two types. One is known as your East African sleeping sickness, and other one is known as your West African sleeping sickness. How to remember this? West Africans are the best African. Just a way to remember. West are best African. They copy all the Western culture, right? And in the early phase and in the late phase. So when I say the late phase, right, the late phase of this trypanosomiasis, right, there will be neurological involvement. So instead of telling you late phase, oftentimes the word can also give you that there is a neurological involvement already. Which of the following drug will you use, right? So in the early phase, what will you use? East African sleeping sickness, early phase mein you will be using suramine, है ना, suramine, right? And in the West African sleeping sickness, remember, this West African are the best African. Can any one of you tell me what is the best African? Remember, this best African, they are living in a penthouse, so you can remember like this: pentamidine. West African, they are copying Western culture and they are living in a West house. Okay, so pentamidine. I hope it is clear now, right? So East African, पूछो कहाँ है sleeping sickness है, तो बोलेगा सो रहा है, suramine सो रहा है. Okay, I hope it is clear now, right? So East African, suramine. West African will be pentamidine. However, if the same question will be like this: late phase of West African sleeping sickness. So penthouse are having better floor. So remember, the name of the drug is your E-flornithine, है ना? eflornithine is the drug that is used for the late phase of West African sleeping sickness, right? West African sleeping sickness. All right. Can any one of you tell me which of the following drug will you use in the late phase of East African sleeping sickness? Some of you have even given the answer as a C, right? So pentamidine is the correct answer. That is absolutely correct. Some of you have given the benz, right? Benzonidazole you have given. Remember, guys, the benzonidazole that we are having, it is for the right South American trypanosomiasis, right? South American trypanosomiasis. They are used mainly for the South American trypanosomiasis. And this South American trypanosomiasis, remember, it is also known as your Chagas disease. Okay, Chagas disease. How we remember this? Chagas disease is sounding like Jhakas disease, and the South American people are Jhakas people, and the Jhakas people, they travel always and always in Jhakas car, and the name of the Jhakas car is a Benz car. So remember, benzonidazole is considered the drug of choice for right South American sleeping sickness. I hope it is clear to all of you, right? Do not forget this anyway, right? Okay, apart from this, I forgot this one more here, that is a melasoprol, है ना? Late में melasoprol. Okay, melasoprol. I missed to write it here. So just remember this, very very important. Okay, melasoprol is a East African late phase, right? Sura means Sora hai. West African are the best African. They are living in a penthouse with a better floor, है ना? With a better floor. I hope it is clear to all of you, and you will never make any mistake if the question is going to be asked on the trypanosomiasis. Okay, so trypanosomiasis, African and South American. Two parts हो गया, African and South American. African trypanosomiasis also known as your sleeping sickness, that is further divided into East African, West African, right? And South American will be your Chagas disease. Okay, next question. A HIV positive patient was taking antiretroviral therapy. He develops hypertriglyceridemia. Which of the following drug could have caused this particular hypertriglyceridemia? So there are multiple drugs that we are having: tenofovir, nelfinavir, nevirapine, dolutegravir. So multiple classes of drugs are there. So in HIV, remember last time also I have given you a few HIV questions, right? HIV, TB, malaria. Question, definite questions, right? So हमेशा question पूछ रहा है, is on the basis of them that only I am telling you. So just remember this. Three important that I told you. So in the HIV, what you needed to know is which drug is belonging to which class. Like for example, all the Navir drug that we are having, like nelfinavir, right, ritonavir, है ना, जितने भी Navir हैं, lopinavir, saquinavir, multiple Navir drugs are there. All of them are actually your protease inhibitor, है ना. So knowing the name of the right and their side effect, very very important, right? And this hypertriglyceridemia is a side effect that is actually associated with this protease inhibitors only, right? And the side effect, if I have to summarize, how will I summarize, and what all things that you I must tell you to remember, that the side effect for this protease inhibitor, remember, is very easy to remember. Remember, GI bleeds with HCl, right? GI bleeds with HCl is a very important, right? GI bleeds with HCl is a very important mnemonic to remember. Okay, very simple mnemonic to remember for the right protease inhibitor side effect. What is GI bleeds with HCl stand for? GI bleeds with HCl stand for your GI related side effect. Like for example, your nausea, vomiting, diarrhea. Most commonly out of all of them will be diarrhea. Okay. So in one of the AIIMS question they have given this, and they have given that it is associated mainly with constipation. Please do remember, not the constipation but the diarrhea. Bleeds with, it increases the bleeding risk, right? It increases the bleeding risk. Very important, right? Bleeding risk is also increased, right? Mainly your intracranial bleed can also be seen. Intracranial bleed can also be seen. Question will be asked to you that which of the following is having maximum risk? Remember, maximum risk is associated with a newer one by the name of tipranavir, है ना? Tipranavir is having maximum risk. Okay, then other one that we are having is the ritonavir, that is one of the very potent enzyme inhibitor. Ritonavir, they are the one that is maximally associated with your bleeding risk. So examiner has already asked you which of the following drug can increase the risk of intracranial bleed. Please do remember that we are talking about the protease inhibitor. HCl stand for you, it will be causing your hepatotoxicity, right, or hyperbilirubinemia and hepatotoxicity. Hyperbilirubinemia and hyperbilirubinemia and hepatotoxicity. And remember, this hyperbilirubinemia and hepatotoxicity is also associated maximally with the same, right, that is your tipranavir and ritonavir, right? Right. Apart from this, right, your cholestasis. Then remember, it can also cause your lipodystrophy syndrome, right? Lipodystrophy syndrome. Now the question asked that can be given to you will be the language like this, right? Lipodystrophy syndrome will be having question like this or language like this, that which of the following drug can cause development of the buffalo hump, है ना? So ये लाइन इस टर्म को याद रखिएगा, एंटी रेट्रोवायरल ड्रग कॉजिंग बफेलो हम्प और कुशिंगोइड अपीयरेंस, है ना? So the particular this language that I am telling you, this is very important. Buffalo hump and Cushingoid appearance is associated with which one? That is your right Navi drug, right? Which class of drug is nevirapine, guys? Nevirapine is mainly one of the NNRTI, right? Non-nucleoside reverse transcriptase inhibitor, NNRTI. These NNRTIs, guys, remember, mainly associated with the hepatotoxicity, rashes, hypersensitivity reaction. Okay, dolutegravir mainly your इंटीग्रेज इनहिबिटर है ना, देखिए नाम में ही है इंटीग्रेज इनहिबिटर. इंटीग्रेज ऑफ द वायरस इनहिबिटर विल बी डोलुटिग्राविर, सो रैल्टिग्राविर, डोलुटिग्राविर, है ना. सो दे आर द इंटीग्रेज इनहिबिटर्स. तो व्हाट इज मोर इंपॉर्टेंट इन दिस क्वेश्चन इज नॉट ओनली अबाउट नेल्फिनाविर that you should remember. Apart from that, the other drugs, dolutegravir is integrase, because remember 2019 November AIIMS question they simply asked, right? Not AIIMS, sorry, PGI question they simply asked which of the following drug is one of the integrase inhibitor, which of the following is integrase inhibitor, and there were 2 integrase inhibitor out of the 5. PGI ने last year पूछा था, है ना? Very simple question. Okay, tenofovir is one of the nucleotide reverse transcriptase inhibitor, है ना? क्या है? Nucleotide reverse transcriptase inhibitor, that is your tenofovir. T से nucleotide याद करिए, है ना? So multiple drugs are there and multiple information that we have discussed, right? So GI bleeds with HCl is very simple mnemonic to remember your side effect of the Navi drug. Next one. Drug used in the post-renal transplant patients: cyclophosphamide, tacrolimus, rituximab, bortezomib. Please start with your answers already. Which of the following drug do you think will be used in the post-renal transplant patient? Whether you will use cyclophosphamide, tacrolimus, rituximab और bortezomib, क्या यूज करेंगे? और इन सबके एक एक ड्रग के बारे में आपको पता होना चाहिए, कौन से क्लास के हैं, इनके इंपॉर्टेंट साइड इफेक्ट्स क्या हैं, है ना? व्हाट आर देयर टारगेट ड्रग्स, है ना? कहाँ पे टारगेट करते हैं ये, राइट? ये इंपॉर्टेंट चीजें पता होनी चाहिए आपको, बिकॉज दे आर वेरी हाई टॉपिक्स. ऑल ऑफ यू प्लीज. ओके, yes, very good. So majority of you, right, post renal transplant you needed to give what? Post renal transplant you will be needing the immunosuppressants, है ना? Immunosuppressant agent. Okay, immunosuppressant you can use. So immunosuppressant you can use like your basiliximab, daclizumab, है ना? Right? Apart from the tacrolimus, cyclosporine, right? These are the ones that can be used, right? So tacrolimus, yes, exactly, all of you have got this correctly. Not cyclophosphamide. Cyclophosphamide is one of the alkylating agent. No, cyclophosphamide is one of the anti-cancer agent. Cyclophosphamide is one of the anti-cancer agent from the class of the alkylating agent, है ना? From the class of alkylating agent. What is alkylating agent? That is cell cycle non-specific anti-cancer drug. What is rituximab? I have told you in my previous classes. Ritu, right? Ritu is a 20-year-old girl who never does wafa, है ना? So ofatumumab. So Ritu wafa नहीं करेगी because she is 20 years old, है ना? So anti-CD20 monoclonal antibody, Ritu, है ना? Rituximab, ofatumumab. There are multiple uses of rituximab, and I have told you in my previous class as well how to remember rituximab ka uses or their uses, because their uses are very important, right? Their uses, they can be used in a patient with a CLL. I'm sure you guys are aware the regimen for CLL is FCR regimen, है ना? FCR, that is fludarabine, cyclophosphamide, rituximab. Once again rituximab. Ritu कितने साल की है? 20 ईयर की है एंड वफा नहीं करेगी, है ना? CLL, है ना? Then it can also be used for the rheumatoid arthritis, idiopathic thrombocytopenic purpura, right? SLE, right? SLE, and it can also be used for the non-Hodgkin's lymphoma. I'm sure you guys are also aware that non-Hodgkin lymphoma we use R-CHOP regimen, है ना? R-CHOP regimen use करते हैं ना non-Hodgkin lymphoma में. तो first drug itself is your rituximab. I hope it is clear to all of you. So how to remember? Ritu wafa नहीं करेगी because she is 20-year-old and their uses are remembered by the mnemonic Krishna, है ना? अब बताइए इससे आसान क्या होगा, राइट? कृष्ण आर द वेरी सिंपल निमोनिक, कृष्ण CRISN आर द यूजेस ऑफ द रितुक्सिमाब. ओके, व्हाट इज बोर्टेजोमिब? ज़ॉम्बी, दैट इज वन ऑफ द प्रोटियोजोम इनहिबिटर. सो ये आपको एक क्विक रिवीजन हो रहा है. आई एम श्योर ऑल ऑफ यू गाइस हैव स्टडीड दिस ऑल इन माय क्लासेस, बट दिस इज अ क्विक रिवीजन फॉर ऑल ऑफ यू दैट यू नो व्हेन यू आर सिटिंग इन फ्रंट ऑफ द स्क्रीन, राइट, एंड व्हेन द क्वेश्चन कम्स फॉर द वेरी फर्स्ट टाइम, समटाइम यू गेट कंफ्यूज, है ना? And majority of you, instead of marking tacrolimus, you will be immediately marking cyclophosphamide just by reading cyclo. Cyclophosphamide could be cyclosporine also, and cyclosporine is also one of the immunosuppressant that can be used in the post-renal transplant. So what are the other agents that we'll be discussing subsequently, but as of now just remember proteasome inhibitor is your bortezomib, and they are considered the drug of choice in a patient with a multiple myeloma, right? Multiple myeloma, very very important drug of choice. Earlier melphalan was considered the drug of choice, right? Although melphalan is among the first line, but now bortezomib is a proteasome inhibitor, right? One of the small molecule inhibitor that happens to be the drug of choice for the multiple myeloma. Okay. Other immunosuppressants, right? So calcineurin inhibitor that we are having are the drugs that we are having. Just to save some time, I have typed this. So tacrolimus and cyclosporin, as I told you already, tacrolimus is one of the calcineurin inhibitor. Okay, that is going to inhibit the activation of T cell, actually involved in the inhibition of the activation of the T cell. Okay, then anti-proliferative agent like mycophenolate, mofetil, azathioprine, mTOR inhibitor, that is mammalian transcription of rapamycin inhibitor, that is sirolimus. Then you are also having your everolimus, right? Sirolimus, everolimus. Then steroids like prednisolone can also be given, and monoclonal antibody, right? That is your basiliximab, daclizumab, right? Basiliximab, daclizumab, that is your interleukin 2, right? Basiliximab, daclizumab, LM2zumab, right? LM2zumab, right? LM2zumab is also one of the, right, monoclonal antibody that can be used. Okay. Next, antimicrobial agent which also possess MAO inhibiting property and has the propensity to cause serotonin syndrome. I mean, this is one of the AIIMS question, you won't believe, and I'm sure all the students, those who are live right now, they can easily mark this correctly. Antimicrobial which also possesses MAO inhibiting property and has a propensity to cause serotonin syndrome. Okay, so serotonin syndrome bhi kar sakta hai or MAO inhibiting. So I think almost all the MAO inhibitor can cause this, but here let us see how many of you can get this. Come on, start guys. Okay, great. Prabhakar has started already. So see, in the previous question what we were discussing is one of the immunosuppressants. Now we are back to the antimicrobial. So since it's one of the last minute revision, so different topics will be discussed, all the high yield topics. So this topic, इस topic में जो भी drugs discuss कर रहे हैं, important point discuss कर रहे हैं, उसको आप note करते जाइए, right? Keep on noting it so that it's going to be your last minute revision thing. Okay. All of you in favor of B, very good, and I'm so happy, right? कि linezolid सबने मारा correctly, and that is a correct answer. Linezolid is one such drug that is having a MAO inhibiting property, right? Linezolid, guys, is one of the protein synthesis inhibitor, है ना? It is one of the protein synthesis inhibitor that is acting as a 50S inhibitor, 50S, है ना? So there is a newer one, the younger brother of linezolid that we are having is also your tedizolid, है ना? Tedizolid. Linezolid and tedizolid is the younger brother of linezolid. Okay, it is having additional MAO inhibiting property, therefore it can cause serotonin syndrome. And you should also remember a very important thing, that important side effect associated with them has been a part of the multiple time, it has been a part of your MCQs, right? That it can cause your bone marrow suppression and it can even cause your peripheral neuropathy. Since it is causing mitochondrial toxicity, I repeat once again, since it is causing mitochondrial toxicity, guys, the rapidly dividing cells of the body like bone marrow, right, they will they will be affected, causing your bone marrow suppression, can also lead to peripheral neuropathy. Now try to understand this. Tedizolid is one of the drug who is lesser associated, like less associated with the tedizolid. This bone marrow suppression, peripheral neuropathy, it is less associated with your tedizolid. Okay, that is your linezolid. Linezolid is one such drug that is having very high oral bioavailability. इस पे भी क्वेश्चन पूछा हुआ है. It is having a high oral bioavailability, right? Almost 100%. Although oral drug will never be having 100% bioavailability, it is only IV drug is having 100% bioavailability. Tedizolid की अगर बात करें तो tedizolid is having 85% oral bioavailability. Tedizolid is having 85% oral bioavailability. Okay. Okay. Apart from that, remember streptomycin is one of the aminoglycoside, bacitracin cell wall inhibitor, polymyxin cell membrane inhibitor. They do not have MAO inhibiting property. They do not cause serotonin syndrome. This also explains the fact that which of the following antimicrobial drugs should not be given to a patient who is on MAO inhibitor, right? Since it itself is causing MAO inhibiting, they should be actually contraindicated in patients on MAO inhibitor. So, आपको instead of giving a direct line, they'll give you a patient is presenting, a 65-year-old patient of the, let us say, Parkinsonism is presented with who is on selegiline, right? With selegiline or rasagiline. What are the MAO inhibitors? Selegiline, rasagiline. They are the MAO-B inhibitor. Okay. So 65-year-old male presenting with one of the drug who is on selegiline, and he is currently having this particular infection. Which of the following antimicrobial you will not give? So instead of giving this line, they can also give you the clinical base. So see, concept is same. ओवरऑल पिक्चर देखेंगे तो कॉन्सेप्ट तो सेम है, है ना, 65 ईयर है, सेलेजिलिन है, तो यू शुड नो व्हाट इज सेलेजिलिन, सेलेजिलिन, रासाजिलिन, सफिरामाइड, दे आर द माओ बी इनहिबिटर, है ना। तो और मोक्लेबामाइड डिप्रेशन के लिए करते हैं, माओ इनहिबिटर। सो अगर ऐसे क्वेश्चन आता है तो आप लोग को ध्यान से पढ़िएगा, आई एम श्योर यू विल बी एबल टू क्रैक द क्वेश्चन इजीली। मेनली क्या है, बस कॉन्सेप्ट होना चाहिए। ओके, पॉलीमिक्सिन सेल मेम्ब्रेन इनहिबिटर, स्ट्रेप्टोमाइसिन वन ऑफ द अमाइनोग्लाइकोसाइड्स, राइट, बेसिट्रासिन सेल वॉल इनहिबिटर। Okay, this is one of the NEET PG 2019 question. I hope all of you guys can easily get this and mark this correctly. YouTube notification नहीं आया, I don't know doctor why it is happening. I think मेरे में भी नहीं आया, हो सकता है कुछ एरर होगा मेरे क्लास के साथ somehow। हाँ, मेरे में भी नहीं आया नोटिफिकेशन, बाकी सबके तो आए हैं, मेरे में भी नहीं आया। आई थिंक सॉरी अबाउट दैट, बट आप लोग शेयर कर लीजिएगा आपस में, जो भी आपके फ्रेंड्स हैं, डॉक्टर प्रभाकर एंड अदर स्टूडेंट्स, सॉरी अबाउट दैट, आई थिंक कुछ प्रॉब्लम रहा होगा। ओके, सो दिस इज वन ऑफ द नीट पीजी क्वेश्चन। डॉक्टर संदीप हैज डिलीटेड शांतन बसु एंड ऑल ऑफ यू इन फेवर ऑफ डी। ओके, सो अ मैनी पेशेंट हु इज ऑन लिथियम थेरेपी डेवलप हाइपरटेंशन, ठीक है, सो मैनिया विद हाइपरटेंशन, केस को पढ़ते चलिए। There is a patient that is coming with the mania plus hypertension, ठीक है, he was started on thiazide diuretics, very good for the hypertension. After few days he developed abdominal pain, right, vomiting, cold stomach. So this abdominal pain, vomiting, cold stomach, they are the early symptom of the lithium toxicity. Remember this, है ना, GI side effect, myopathy, tremors, है ना, ये they are the early side effect of the, right, lithium toxicity. Which of the following could be the likely mechanism? So why likely mechanism? Because since the patient is on mania, he was started on the antihypertensive drug by the name of thiazide. That means there is some drug interaction with the lithium plus thiazide. I think ये क्वेश्चन आपके समझ में आ गया होगा कि कुछ तो लफड़ा है, कुछ तो प्रॉब्लम है ना। थायराइड कुछ तो कर रहा है कि लिथियम टॉक्सिटी हो रहा है। नाउ थायराइड ऐसा क्या कर रहा होगा कि लिथियम टॉक्सिटी होगा? मेरी बात को ध्यान से पढ़िएगा, थायराइड ऐसा क्या करेगा कि लिथियम की टॉक्सिटी होगा? गाइस, थायराइड इज नेवर गोइंग टू प्रोमोट द एक्सक्रीशन। इफ द एक्सक्रीशन विल बी प्रोमोटेड, टॉक्सिसिटी विल नॉट हैपन। मेरी बात को ध्यान से सुनिए, इफ द थायराइड विल प्रोमोट एक्सक्रीशन बिकॉज थायराइड इज अ डायरेटिक एक्टिंग ऑन द डीसीटी बाय ब्लॉकिंग NaCl co-transporter. If the thiazide will be promoting excretion, lithium toxicity will not happen. Simple as that. That means thiazide actually is doing something, right, due to which lithium is more reabsorbed inside the body. Okay, so metabolism of the lithium inhibited by the thiazide, it does not affect the metabolism. Okay, thiazide act as an add-on drug to the lithium? No, because lithium is acting via a different mechanism and thiazide is acting at the nephron. Okay, thiazide decreases the tubular reabsorption. Decreases the tubular reabsorption. अगर tubular reabsorption को decrease कर देगा तो toxicity तो नहीं होगा ना? If the decrease, if the right, please try to understand the concept, ना? If the thiazide decreases the tubular reabsorption of the lithium, then there will be, right, there will be no toxicity. No reabsorption, that means all of will be excreted. Then there will be excreted and there will be no toxicity. Read option D. Thiazide increase the tubular reabsorption of lithium. Increase the tubular reabsorption. Why? Reason being, try to understand what is the site of thiazide. What is the site of thiazide, guys? The site of thiazide will be at the DCT and it is going to cause by blocking your NaCl co-transporter. है ना, इट विल बी ब्लॉकिंग योर NaCl co-transporter. DCT पे काम करके NaCl co-transporter को इनहिबिट करेगा एंड दैट विल बी कॉजिंग योर natriuresis. व्हाट विल यू कॉल इट इज एज अ natriuresis. जब ये natriuresis करेगा, सोडियम का लॉस होगा. There will be loss of sodium. In response to this loss of sodium, the body will try to compensate, and as a compensatory mechanism, right? As a compensatory mechanism, there will be more sodium reabsorption from the PCT, right? More sodium reabsorption from the PCT, and try to understand. This lithium is also being transported through the same sodium channel. Lithium का reabsorb होने का जो place है, the area from where the lithium is reabsorbed is same as sodium. So compensatory sodium reabsorption from the PCT, right? And this will be seen along with the, right? This will be seen along with the lithium, right? So what will happen? The level of lithium will be increased, that is causing your lithium toxicity. Try to understand, guys. Lithium is one such drug that is having narrow therapeutic index. क्या है? Narrow therapeutic index. That is why with the lithium therapeutic drug monitoring is required, right? TDM is required with the lithium. Therapeutic drug monitoring is required because it is having very naya therapeutic index. Okay, that will be right. I hope all of you guys have already got this. Since time थोड़ा कम है और डिस्कस करने के लिए ज़्यादा है, इसलिए राइट इतना काफ़ी है. बाकी लिथियम के बारे में बहुत पढ़ाया मैंने आप लोगों को, राइट. पूरी लिथियम डिस्कस कर रखी है. लिथियम की जितनी रामायण है ऑलरेडी डिस्कस इन द CNS. ओके ओके, आई थिंक कुछ चीज़ें यहाँ पे टाइप्ड हैं, तो लेट अस सी what are the important thing. Okay, so this is, I have already told you that lithium causing natriuresis, and therefore there is a compensatory reabsorption of the sodium and lithium from the PCT, है ना. ये तो क्लियर होगा. एंड दिस डिक्रीजेस द क्लियरेंस ऑफ द लिथियम कॉजिंग योर टॉक्सिसिटी. ओके, द लेवल ऑफ द लिथियम विल बी 0.6 to 1.5. ओके, द थेरेप्यूटिक प्लाज्मा कंसंट्रेशन दैट वी आर हैविंग इज 0.6 to 1.5 मिली इक्विवेलेंट पर लीटर. ओके, then there are something that which drug can increase the lithium excretion, something that is very very important and has been asked already in NEET PG, not in your examination but NEET PG में पूछा गया है, right. Although this is classes for everyone of course. Okay, so can cause lithium retention, that will be your indomethacin and your lisinopril. Indomethacin and lisinopril, one is the COX inhibitor, other one is your ACE inhibitors. Okay, increase the lithium excretion are these two, right. Increase the lithium excretion, so they will promote the excretion. When they promote the excretion, then the risk of toxicity will be reduced, right. Increase lithium excretion, risk of toxicity will be increased. So diuretic, osmotic or carbonic anhydrous and the potassium sparing diuretics. Okay, potassium sparing diuretic, they are going to promote the lithium excretion. I hope it is clear to all of you. Okay, बिल्कुल डॉक्टर शंतन मसू, एग्जैक्टली. ओके ओके, नोटिफिकेशन के लिए रिमाइंडर ऑन करना पड़ेगा. यस, आई थिंक मैंने मॉर्निंग में ही, नॉट मॉर्निंग बट आई वुड से आई थिंक 11-12 के आसपास मैंने लिंक शेयर कर दिया था. तो जब भी लिंक मिले तो आप उस पर आई थिंक क्लिक रिमाइंडर कुछ ऐसा करने से हो जाएगा शायद. और यू शुड ऑल्सो बी यू शुड सब्सक्राइब विद क्लिक ऑन द बेल आइकन ऑफ दिस Unacademy, I think. Okay, very important question. All of the following are prokinetic except प्रोकाइनेटिक. आई डोंट नो, समहाउ ये भी इनका काफ़ी फेवरेट टॉपिक है, सो इससे भी क्वेश्चन पूछते हैं, है ना. तो कई बार तो थोड़े कॉन्स्टिपेटेड क्वेश्चन होते हैं बट समटाइम प्रोकाइनेटिक वाला क्वेश्चन भी आता है. तो प्लीज रीड द क्वेश्चन. ऑल ऑफ द फॉलोइंग आर प्रोकाइनेटिक एक्सेप्ट प्रोकालोप्राइड, मेटोक्लोप्रामाइड, मैक्रोलाइड्स, ग्लाइबेनक्लामाइड. सबके नाम में आइड वर्ड आ रहा है तो थोड़ा सा हो सकता है कंफ्यूजन हो. सब लोग बताइए. सारा कुलसुम एंटीबायोटिक पे लेक्चर करें डेफिनेटली डॉक्टर. टुमारो there is a lecture that will be antibiotic will be covered, so antibiotic का रिविजन होगा, उसके बाद से उस पर MCQ भी होगा. tomorrow at Unacademy, आप if you have the app you can check out the schedule. I think in the night time it's there, tomorrow 8 PM it's there. Okay, Dr. Sara Kulsum, that's one reminder for you. Okay, so I think all of you have easily got this, right. D is the correct answer. What is glibenclamide, guys? Glibenclamide is one of the second generation sulfonylureas, है ना. सेकेंड जनरेशन सल्फोनाइल यूरियास है ना. तो ये तो इंसुलिन सिक्रीटागॉग हो गया ना, ये तो एंटी डायबिटिक होते हैं ना, ओरल हाइपोग्लाइसेमिक एजेंट में आते हैं, है ना. इंसुलिन सिक्रीटागॉग, ओके, इंसुलिन सिक्रीटागॉग. नाउ व्हाट इज प्रोकालोप्राइड? दैट इज वन ऑफ द 5-HT4 एगोनिस्ट. मेटोक्लोप्रामाइड, डोमपेरिडोन, they are the D2 receptor blocker. Macrolides are the motiline receptor agonist. Okay, so remember macrolide can be used also as a prokinetic agent, right. Conditions like your diabetic gastroparesis, but the problem is that it's not FDA approved, but off label it can be used, right. Okay, so these are some of the prokinetic agent, right. Prokinetic agent, metoclopramide is a prokinetic agent, but it can cross the blood-brain barrier as well, because metoclopramide is causing blood-brain barrier. Remember, it is, it can cause abnormal posture or development of the extrapyramidal symptom. Likewise, domperidone के साथ ये problem नहीं है. We do not have such problem with the domperidone, but metoclopramide can cause extrapyramidal symptom and hyperprolactinemia as well. Okay, this has been a question of the AIIMS as well. Okay, so motiline receptor agonist, macrolide is also there. Okay, then remember other drugs that we are having under the motiline receptor agonist. What are the other drugs that we are having? That is your specific drug, that is your metamcinal and camicinal, है ना. Metamcinal and camicinal, they are the other है ना, मोटिलिन रिसेप्टर agonist. Their motilin receptor are present in the intestinal wall, that is going to increase the motility, है ना. Then there are the drugs that are acting as the CCK, right, CCK, है ना, CCK, that is dexloxyglumide, right, dexloxyglumide, CCK, cholecystokinin, cholecystokinin antagonist will be your dexloxy. So C dexloxyglumide, है ना, C dex, so C से CCK dexloxyglumide, है ना. So glibenclamide, dexloxyglumide, confuse नहीं होइएगा, है ना. glibenclamide is one of the second generation sulfonylureas used as one of the oral hypoglycemic agent, insulin secretagogue. Okay, that is going to act by what? That is your ATP sensitive potassium channel blocker. It is one of the ATP sensitive potassium channel blocker. Okay. Prucalopride, definitely I'm sure you guys can understand, can be used in any cases where the prokinetic action is required, like for example diabetic gastroparesis. Yes, can be used prucalopride. Apart from that, where else you can use it? Can be used in a condition like, let us say, irritable bowel syndrome, right, that is associated with your constipation, or you can say constipation dominant irritable bowel syndrome, उसमें यूज कर सकते हैं ना, constipation dominant irritable bowel syndrome. Okay, metoclopramide, domperidone, D2 receptor blocker, macrolides, right, are having off level, having this action. Okay, especially the erythromycin, Okay, I hope prokinetic वाला ये टॉपिक हो गया, right? Yes, doctor. General pharma is scheduled on 29th. 29th is Sunday. Yes. So all the students, those who are listening to me right now, please take note down. Take a note. And the classes are scheduled already in the last minute revision program. So general pharma is scheduled on 29th. On 29th, multiple classes are scheduled. So you can check out the schedule and you can attend the classes live, and you can also share the link with your friends. Okay. So general pharma is already, yes, definitely, Dr. Rizvi, I have already scheduled, and I will be discussing general pharma on 29th. Okay. आई होप इट इज क्लियर टू ऑल ऑफ. जनरल फार्मा में डिस्कस करूंगा. ओके, भाई तो बता रहा हूँ 29th को इंडिविजुअल क्लास 29th को करेंगे ऑन द ऐप पे करते हैं. ओके, नहीं, जो भी मैं आपसे अनाउंस कर रहा हूँ, दे आर ऑल फ्री क्लासेस, दे आर नॉट प्लस, दे आर नॉट चार्जेबल, दे आर ऑल फ्री क्लासेस, है ना. सारे के सारे फ्री क्लासेस हैं, मोस्टली मेरी क्लासेस फ्री है. ठीक है डॉक्टर रिजवी, आई थिंक योर प्रॉब्लम इज डन. शांतन बसु, दे आर ऑल फ्री क्लासेस, राइट, and no more class. No, that's all. Which of the following antihypertensive drug is avoided in patient with a high serum uric acid level? I think this is the last question. Okay, टाइम भी नहीं है, तो जल्दी से बता दीजिए इसका आंसर क्या होगा. आप लोग कैलेंडर मार्क कर लीजिए और मेरे प्रोफाइल पे जाके आप लोग देख सकते हैं जो भी क्लासेस शेड्यूल्ड है, और जस्ट सिंपली शेयर द लिंक. आई विल शेयर द लिंक ऑल्सो इन आवर ग्रुप्स, इन Facebook group and different social media platforms. I will be sharing the link very soon. Okay. So which of the following antihypertensive drug is antihypertensive drug avoided in patient with the high serum uric acid level? So any drug that is also causing hyperuricemia will be avoided in the high serum uric acid level, or option can also give you avoided in gout patients. Which of the following is avoided in gout patients? Avoided in gout patient. Okay, so that is going to be your hydrochlorothiazide. Okay, that is going to be your hydrochlorothiazide. Why? It itself is causing hyperuricemia. It is going to inhibit the reabsorption of the uric acid. That will be hydrochlorothiazide will be causing hyperuricemia by causing the inhibition of the secretion of the uric acid. Okay, hydrochlorothiazide. Enalapril has no such action. Prazosin likewise, and atenolol also. Okay, in fact, prazosin is one such drug that increases the uric acid excretion. It increases the uric acid excretion, therefore it is a preferred drug. It is preferred drug in a hypertensive patient with the gout. It is also considered a preferred drug, right? Preferred drug in hypertensive patient with the BPH, benign prostatic hypertrophy. Okay, I hope it is clear to all of you. Atenolol is one of the cardioselective beta blocker. Prazosin is one of the, right, selective alpha 1 blocker, right. Enalapril that we are having is one of the angiotensin converting enzyme inhibitor, ACE inhibitor. Okay, I think that will be everything. Okay, one more question, sorry about this. एक क्वेश्चन और आ गया आपके लिए, so last question मार्क कर दिए जल्दी से. Okay, a person was given a muscle relaxant that competitively blocks a nicotinic receptor. Which of the following drug is used for the reversal of the muscle relaxation after surgery? I mean, this is a question that is already asked in your examination, and I am directly asking. Okay. Yes, losartan also. Yes, doctor, because losartan is also having a uricosuric property. Losartan is also preferred in gout. बिल्कुल. Dr. Shantan Masu, answer to your question is yes. Okay. Next that we are having, okay, so post-op muscle paralysis के लिए we always give neostigmine, and try to understand along with the neostigmine we also add atropine. Now this is one of the ANS question. You should try to understand that what is neostigmine, guys. What is neostigmine? Is one of the neostigmine that we are having is one of the reversible acetylcholine esterase inhibitor. This reversible acetylcholine esterase inhibitor, it is going to increase acetylcholine markedly, and acetylcholine level will be increased. Try to understand the fact, if the acetylcholine is increased, if ever the acetylcholine is increased, it is going to act on both the receptors. It will be acting on the nicotinic receptor and muscarinic receptor both. Now whenever you are going to give a muscle relaxant, you will be giving, let us say, a depolarizing or non-depolarizing. All the muscle relaxant, they are one of the NM blocker. Yes or no? D-tubocurarine, है ना, मीवाक्यूरियम, रापाक्यूरियम, ना, जितने भी हैं, they are all one of the neuromuscular blocker, right? So at the neuromuscular junction, let us say neuron and muscle, at the neuromuscular junction, they will be producing the blocking effect. Because of this particular reason, you want your action only till the nicotinic action, and you do not want at the muscarinic action. See, acetylcholine is going to act on the M1, it will be acting on M2, it will be acting on M3. By acting on the M1, right, it can produce, right, a CNS effect, because M1 is also present in the CNS, right? By acting on M1, it can also produce some GI distress, or let us say development of peptic ulcer disease, because M1 present in the gastric parietal cell. M2 पे काम करके it will be causing bradycardia. M2 is one that is acting by GI, causing bradycardia. M3 पे, by acting M3, it will be causing a bronchoconstriction. It will also be causing increase in the secretion, that is going to increase the risk of aspiration. Now all this problem, that is increasing the secretion, increasing the risk of aspiration, bronchoconstriction, bradycardia, neurological symptom, will be coming only because the excess acetylcholine is acting on the muscarinic receptor. See, you do not want your action here, you want your action at the nicotinic receptor, NM पे चाहिए आपको, you do not want your action here. Therefore what you should do, you should, why not block this, no, block करो इसको, है ना, so that your action can be limited, action of acetylcholine can be limited till the NM. So atropine is one of the non-selective muscarinic antagonist, right? So therefore, in any patient of this post-op muscle paralysis or snake bite, because snake bite is also same, right? The poison of the snake bite that we are having, they are also going to act at the same, at the NM junction, है ना? डॉक्टर मोइन अंसारी, ये एनबी का ही क्वेश्चन है, राइट? 2019 नीट पीजी का क्वेश्चन है, ये जो क्वेश्चन मैं आपके सामने रखा हूँ, राइट? नीट पीजी का क्वेश्चन है ना? तो आपके एग्जाम में मोस्टली जो क्वेश्चन आ रहे हैं वो मिक्स बैग हैं, है ना? सो लास्ट एग्जाम वाज अनफॉर्चुनेट, दैट वाज समथिंग मोस्टली क्लिनिकल, बट दिस इज वन ऑफ द नीट पीजी क्वेश्चन. अगर आपको यकीन नहीं है तो मैंने नीट पीजी क्वेश्चन 2019 के ग्रुप में डाले हुए, किसी सारे फैकल्टी ने डाले हुए, जितने भी फार्मा की फैकल्टी है सब ने शेयर किया. आप ये क्वेश्चन मैच कर लेना, ये क्वेश्चन आया हुआ है ना, आपके एग्जाम का क्वेश्चन है, ठीक है? सो ये सिंपल क्वेश्चन बिल्कुल आता है. यस, सो दैट विल बी एवरीथिंग for this particular class. I hope you guys learned something new. A quick announcement for the students, just remember, for the NEET PG 2022, a free test is conducted, right? Free test is conducted every day, right, at 9 p.m. okay, every day 9 p.m. free test is conducted at the app, right? And for the NEET PG 2021 aspirant, every day at 8 p.m. है ना? So 8 p.m. पे 2021 8 p.m. and 2022 9 p.m. पे, okay, every day free test where 20 questions are being posted every day. You can go and attend, and you can test your preparation at any point of time. You can download the app simply by going to your Play Store and simply typing the Unacademy. You will be downloading the learning app, है ना? And by downloading the learning app, you will be going to NEET PG. There are multiple sections are there, like NEET PG is there, है ना? Simply NEET is there. Do not choose NEET, choose NEET PG. There is SSC and all, है ना? उसमें जाकर के आप NEET PG में आप you can choose either plus, you can choose free courses, you can see the special classes. So majority of the questions that we're having, my classes will be in the special class section, that is that I was mentioning you a while ago. Or you can simply search my name by here, by search option में भी आप search करोगे, so मेरे जितने भी classes होंगे सारे के सारे आ जाएंगे. Okay. Yes, exam is delayed. Okay, exam definitely is delayed. Okay. Yes, Dr. Justin GLB, yes, referring to your query, yes. Okay, so that will be everything from my side in this particular series. I hope you guys learned something new, and definitely I'll be seeing you guys in the next classes, and more important topics I'll be discussing here, right? Like the topics like general pharma will be main focus in the next class, plus general pharma and general pharma and or your antimicrobial also, these are something that will be discussed in the last minute revision for the December FMGE, right? So this is actually important for all the students, those who are preparing for the PGME, and it's already scheduled. So tomorrow we'll see you guys also at the Unacademy special class section. Okay, so that will be all. Take a very good care of yourself. I'll see you guys in the live classes.